But we're going to try this exercise now. Here is a scenario about an older woman experiencing skin tears. Shashing is going to put that scenario into the chat so you can refer back to it in your breakout sessions. And we have today our 12 full-time innovation fellows with us, and they are going to go into breakout rooms. We're going to randomly assign you into breakout rooms. Each of you will spend some time with a fellow. This is the assignment on the next slide. So big shout out and thanks to the fellows for being with us. We've got about 15, probably about 20 minutes or so. Take a quick minute or two to introduce yourselves. Take a quick look at that vignette. And then what we want you to do is draft multiple variations of the need statement from that scenario, using the format, a way to address the problem for a population in order to achieve that desired outcome. By the end of the breakout time, you'll need to decide on your preferred variation. And in 30 seconds or less, we'll come back and we'll quickly share a screen, show us your need statement, and tell us what is one or two most important things you need to learn through need research to scope that need statement more appropriately. We're going to just have you read your need statement, and we will hold the what you need to research for another time. So Kathy, can I call on you first?
Yeah, sure. So our group came up with, we want a way to address skin avulsions in elderly populations with paper-thin skin in order to reduce bleeding.
In order to reduce bleeding?
Yes.
Okay. All right, great place to start. Let's hear our second one, Justin, and we'll see how they compare.
Sure thing. Redemption for getting outcome. Our problem was stop uncontrolled bleeding. Our population was elderly patients, elderly women patient on blood thinners, and then our outcome was to reduce the cost associated with further complications.
All right, interesting. So you see how one team's problem was another team's outcome, and the population very, very different, right, in terms of level of specificity. Laura, how about your group?
Yes, our need statement is a way to protect frail skin in elderly patients who are taking blood thinners with new skin avulsions to reduce recurrence of bleeding episodes.
All right, interesting. And again, bleeding as an outcome, but framed slightly differently. So you can start to see how the word choice is meaningful when you're crafting need statements here. Haley, how about you guys?
We had a way to minimize bleeding associated with skin avulsions in elderly patients on blood thinners in order to improve wound healing.
Okay, healing as an outcome, bleeding again as a problem. One of the things that you hopefully picked up on your reading is that sometimes there's this kind of circular thing going on with problem and outcome. And a really good way to start to think about this as you begin working on your own need statements is there's almost a causal or temporal link between the problem and the outcome. So you can think about it that if you were able to address that problem, it would result in this particular outcome. So you want to make sure there's that, if I did this first, it would have this effect. And that can be one way to get yourself out of this loop about, is that my problem or is it my outcome? So keep that in mind. Oliver, how'd you guys do?
Yeah, good. So we had a way to improve hemostasis following trauma in patients on blood thinners in order to reduce hospital visits.
Okay. Again, a different direction, different outcome here, different framing of the problem slightly. Thank you. Krishna.
So our group framed the problem a little differently as well. So we went with a way to address recurrent bleeding in elderly women with a history of blood clots and atrial fibrillation in order to reduce recurrent episodes of minor bleeding.
Okay. All right, in a very specific population there. Yeah. So you can start to see how these decisions compound and how critical it will be through your research to figure out whether elderly women with atrial fibrillation are sufficiently different from other elderly women that they would require a different type of solution. Deepika.
We had the benefit of Anita, who's a plastics expert, but ours was a way to control pre-hospital bleeding for elderly patients on anticoagulation in order to reduce ED admissions.
Okay. A different outcome altogether. And you know, again, you're looking for what outcome is gonna, once you get further in your need research, what outcome, who's your decision maker and what outcome is gonna be most compelling to that decision maker? Michael.
Yeah, awesome. So Sage, Eric, Steven, and I came up with a way to achieve reliable hemostasis in elderly patients on blood thinners to reduce the amount of resources required to stop bleeding.
Okay, so resources more generally, interesting. So that could be human resource as well, like depending on the venue of care, that sort of thing. All right, good. Emily.
So Risha and I came up with 3 different ones, but I'll just read the first one. A way to reduce continuous bleeding in patients who are chronically on blood thinners in order to minimize fainting due to blood loss.
Okay, interesting. Again, fainting, different outcome. Fainting can lead to terrible secondary outcomes, right? So more options to consider. Sabrina.
Yeah, so Bisma, Katie, and I thought of a way to prevent excessive bleeding in patients taking blood thinners in order to reduce operational burden on nursing home staff.
Okay. All right. So thank you, everybody. The point of this exercise is to show you all how there are lots of different choices, right? So your first version of your need statement is a hypothesis. It is your best guess from your observation or your clinical scenario about what's going on. And like any good hypothesis, you know, you may or may not be on track. And so what you need to do is invest heavily in your need research to help you figure out whether, you know, which direction you need to scope your problem, your population, and your outcome to get to a more robust, rigorous, meaningful hypothesis as you go forward.